Hello everyone. Welcome to GrowMed. Welcome back to the Super 30 series and today is the day 9 and today we will be discussing an important topic from the ophthalmology, that is the retinoblastoma. So retinoblastoma is a very important topic and frequently questions have been asked on this. Usually the clinical case type or the questions on the investigation of choice or the image based question have also been asked. So we'll discuss all the questions which were asked in the exam. Okay, so let's start our discussion. So retinoblastoma is usually a disease that occurs due to the genetic mutation, and this is usually seen in young patients. Young in the sense, I mean, like children who are aged less than 3 years. In them only this is seen, like very early we can detect it. Okay, so retinoblastoma, and the gene mutation is the RB1 gene. This is the main gene which is mutated, and the questions are also asked on the exact location of this RB gene. Where is it located? So it is located on the 13th chromosome, long arm 13q14. So this is the exact place where this retinoblastoma 1 gene is seen. Okay, then so the other question asked on this retinoblastoma genes are that retinoblastoma associated other malignancies. So it is the osteosarcoma. Osteosarcoma can also be formed, can also be seen in these patients. Okay, so yes, this is about the genetic mutation. Now looking at the clinical features, so leukocoria means this whitish appearance. If you can see here in this eye, the whitish appearance, this one is called as a leukocoria, sometimes referred to as a cat eye appearance, and this is the most common feature seen in these patients. Then loss of vision can be there can be inflammation, there can be uveitis, there can be also glaucoma is seen in these patients sometimes. And the another most common manifestation seen is the intraocular calcification. Okay, so this leukocoria which you are seeing, this one, this is due to the calcification itself. There will be calcification leading to this appearance. Okay, so yes, this one is the clinical features or the manifestation by which the patient presents. Now the investigation of choice for this one is the MRI. Okay, so on MRI we will be coming to the exact location, how much the big the tumor is, the location, everything related to the tumor we will be knowing on the MRI. Then if we take the biopsy, we can see finding on this one, the histopathological examination. We can see flexor Winster Steiner rosettes. Okay, so that means, see here, the image based question have also been asked in integration with the pathology sometimes for this one. So see here, this flexor Winster Steiner rosettes are uh, cells, and in these cells the lumen, you can see here, the lumen is well differentiated, well surrounded, like you can see a lumen present here and the cells are surrounded to it. Okay, so this one is the flexor Winster rosettes, and these, the other name for this one is, they are called as a true rosettes because they are the center, this center is empty. Okay, so that's why it is called as a true rosettes. Okay, there are from the patho point of view, these rosettes are actually classified into true and false rosettes. True rosette is this Flexner Steiner rosette. The false rosette are the Homewright rosette, and these are seen in medulloblastoma. Okay, medulloblastoma. This was just an extra point from the pathology as we are discussing about the Flexner Winster Steiner. So I thought let me discuss that one also. Okay, so this is about the pathology, histopathological examination. Do remember this, both the images, because both the images are very very important. They can just give like a clinical case describing the features, like a child of age some 3 months presents with leukocoria, loss of vision, and on biopsy you can see this given image. What is the diagnosis? So it will be retinoblastoma obviously, or they can just give that the child is diagnosed with retinoblastoma, which of the following gene mutation causes this disease? So it is the RP1 gene, or they can just directly ask that retinoblastoma gene is located on which chromosome. So these are the various type of questions asked in the past years. So you should prepare in a way that the topic, you should mug up everything, so that whatever question is asked related to that topic, you will be able to solve it easily. And most of my teaching or most of my videos are related to that only, like read the topic and everything related to the topic, like not mostly question oriented or question based. It is like a topic based, so that whatever the question you get from the topic, you'll be able to solve it. Okay, so the treatment modality available for this one is the laser photocoagulation. In most of the cases, we prefer laser photocoagulation, and the chemotherapy, we can also use chemotherapy. The drugs used are this vincristine, etoposide plus carboplatin. So these are the drugs used for the chemotherapy, and if more than 50% of the eyeball is involved, then enucleation is the better treatment option available. And another simple one liner asked on this question was that most common site of the metastasis, and it is the optic nerve. So through the optic nerve, it can spread to other parts of the brain, involving the other parts of the brain and skull. Okay, head and neck. So this is all about the retinoblastoma, which you must know. This is important one. Then the clinical features asked in case of asked in the clinical case, these are important. The investigation of choice, this is important. This is also important. Okay, so have a look at all the points, and see the video once, twice, recall all the points. So you can watch these videos in your break time, and recall the things what all are important. Okay, so thank you so much for watching this video. For more amazing videos like this, stay tuned. If you're new to GrowMed, subscribe to GrowMed, like the video, share it with your friends, and comment below how do you find this video. Is it useful to you or no, and should I continue this series? Okay, so thank you so much. All the best for the exam, and I am Dr. Padmini, your mentor for the FMGE. Thank you so much, guys.